is a 69-year-old woman who has a history of end-stage kidney disease secondary to diabetes. She also has high blood pressure and coronary artery disease and receives routine hemodialysis in our dialysis unit. Last year, Sue was admitted to the hospital for a severe heart attack, and this hospitalization was complicated by an ischemic stroke as well as a bloodstream infection. Since discharge, Sue has been admitted to the emergency room as well as inpatient ward several times for difficult to control blood pressure as well as chest pain. Lou, her husband, is her primary caretaker.
I have gotten to know Sue over the past 5 years while she has been on dialysis. Given her worsening health condition and changes in her quality of life, this seems to be a good time to start a discussion with her about what she might like for her future plans with regards to her care. According to our prognostic tool, she has a 40% likelihood of dying within the next 6 months, and she is within the clinic's high mortality quintile.
Today, we will meet with Sue and her husband to talk about her goals of care as well as her knowledge of her condition.
I would like to welcome you here today to our meeting. Thank you for making the time to visit with us. We want to learn more about what you understand with regards to your care, what your goals are, and how we can make plans with you for the future. We are doing a special project that's called Shared Decision Making and Renal Supportive Care, and you're part of that project with us. So we want to make sure that we're going to proceed in the right way to help you out. Okay. You already know me. My name is Jenny Kitson, and I'm the social worker here in the unit. And Dr. E is also part of the dialysis team. You know her as well. Mm-hmm. But for the record, perhaps we could introduce ourselves around the table here. Sue?
And you certainly know me. I guess I'm the reason that we're all at the table. I'm grateful that you're using my first name. I really do prefer Sue, so thank you.
And I'm her husband, Lou, and we've been married for 40 years.
Well, no, it's going to be 38 in September.
Okay, dear.
Close.
And I'm Dr. E, your kidney doctor, and along with my colleagues, we've had the pleasure of taking care of you, and I'm hoping that today we'll start a conversation about the illness that you have, as well as how you've been dealing with it. This gives us a chance to start talking about how you see the future and your goals, and along with Ms. Kitson, who's taking the lead for our team in the conversation, we want to be sure that we're committed to continuing your care. We all understand that you are the most important person in this room, and it's your views and wishes that we mainly need to hear during this meeting. So, to make sure that we're on the same page, can you tell me a little bit about what you know about your health?
Well, I know that I'm on dialysis because my kidneys are not working. Before I started dialysis, I remember that you explained to me that I was not a candidate for a kidney transplant because of other diseases that I suffer with. Basically, you said that I was too sick. I don't know how long I can be on dialysis. It seems like I've been on for a long time. I gotta say, I hope I'm on it for a whole lot longer. I should also say, however, that life in general has gotten to be much more difficult during this last year since my hospitalization for a heart attack.
I hear what you're saying about the heart attack and having more difficulties. Can you give me a little bit more information about what that means, and particularly say something more about wanting to be on dialysis a lot longer? What does that mean to you?
Well, since my hospitalization, I have just felt so weak and tired that I'm not able to enjoy the things that Lou and I used to do together. We had a very active social life. We liked going out to dinner and meeting with friends. And the thing that scares me about what I'm seeing in our life is that my mother was on dialysis. And after a few years, she became so exhausted that she couldn't enjoy even the simplest of things like crocheting or even reading. She was miserable. We all knew she was miserable, but it kept going on and on and on, kind of like she was in purgatory. I don't want that for myself. On the other hand, I was very serious when I said I'd really like to live a whole lot longer.
And we want her to live a whole lot longer.
But you don't want me to suffer like my mother did, do you?
No.
It seems that Sue and Lou grasp that things are getting worse. We asked Sue in her survey whether she had any particular goals within the next 6 months. She told us that she hoped to see her 2 grandchildren graduate from high school, and we will explore this. She also wrote that she had a conflict with her husband, who wants everything done to keep her alive. He's clearly frightened of losing her, and he will need to gradually learn over time to accept her fate and the importance of letting her take control over her treatment. Thank you for sharing how you both have been feeling. I know that this has been a hard time for you, and it seems that you're both aware that your health status has worsened recently. Have either of you thought about what lies ahead in terms of your health?
I guess I have to be honest, I'm not sure I really want to know exactly what lies ahead. I think I have a sense of it from my mother's experience because she was on dialysis until she died, but I also suspect the treatment has probably improved since then.
Well, indeed, the treatment has gotten better, but as you know, there still is no cure. I can understand what you're saying with regards to the hospitalization not going great, but I've known you for a while now, and I know that you're a person that always has hope, but you're also practical and you plan for the worst. Is that a fair assessment?
That's very accurate. I am proactive and I'd rather be well prepared.
We're fortunate to have Ms. Kitson working on our team, and over the next few months, she will be able to figure out some steps for you to take control of your health. She will discuss with you some resources to help you and your family make plans for the future. From my end, I'd like you to follow up with your cardiologist to see how your heart is actually doing and to see if some of the new medications that you're on have been working properly.
The focus in this meeting will be on her cardiac condition, her treatment, and her medications. Due to time constraints, we will not be showing this on the video. I would like to shift the conversation to Sue's goals. And we are aware of the potential conflict that we might have with her husband, Lou, with regards to the treatment plan. This will not be pursued in depth during this initial interview, but this is an issue that we need to talk about in the future. You did a survey just before we started the meeting, and in that survey you talked about what you would like as a goal for the next 6 months. And one of the things that you mentioned was wanting to be able to go to the graduation of your grandchildren, right? Can you tell me a little bit more about that?
Yeah, and I'm not so sure how accurate I was in that survey. Our oldest grandson will graduate in about 5 months, but our younger one, it's going to be another 3.5 years before she gets her diploma.
Okay. But what's clear in this message is that your family is most important to you.
Absolutely.
And meaningful in your life. And you want to make sure that you can be there for the important things, like this graduations.
And I do hope so.
But?
Well, I think Lou and I have talked about it. We both feel rather strongly that the good Lord is in charge of making these decisions.
With some input from the rest of us?
Yeah.
I hope so.
Yeah, sure.
Good.
Okay, good.
Good. Sue, there are a number of things that we need to talk about during your dialysis sessions over the next few weeks. Such things as making sure we're clear about what your goals are, a living will, what a healthcare proxy is, and also a little bit about palliative care and what hospice services there are in the neighborhood. And Lou, it's important that you be part of this conversation as well, because we want to make sure we're all on the same page together.
Well, I know a little bit about some of these things, but I'm certainly willing to hear more, especially if it's going to help me and us as a family, sure.
It is important for us to know exactly what Lou and Sue learned from the meeting. Sometimes we as professionals assume that they understand everything that has been discussed and that they will remember what we have talked about. One way to test this is to use a technique that's called teach back, which we will use in this particular section.
Well, I'd like to take the time now to review some of the things that we've discussed in today's meeting. Sue, could you tell me in your own words what we've covered today?
I think what's most important to me is that you've given me an opportunity to share with you what is important to me, and that would certainly be my family. That having been said, and it's kind of hard for me to say this, I don't want to spend the last chunk of my life so exhausted that I can't enjoy that family that means so much. That's the way it was for my mother, and it was really kind of yucky.
I hear you, but I also want you to live as long as possible.
I know.
And that's why Dr. Amaka mentioned about you're going to see the cardiologist.
I know. I get it.
Sue has a pretty good grasp of things. She did not ask for specifics of her prognosis, but if she had, I could have explained to her and her husband that although she is chronologically 69 years old, Because of her illnesses, her body is really older. According to our prognostic table, which will be supplied to you as a resource for such conversations, Sue's realistic life expectancy is closer to that of an 80-year-old woman. We have another instrument for you to use during these conversations, and it will show another way of looking at this. According to our calculation, Sue has a 40% likelihood of dying within the next 6 months. No clinical decisions were made during this initial meeting other than Ms. Kitson continuing to sit down with her at subsequent dialysis sessions to go through a checklist of advanced care planning.
I think you heard a lot during this conversation. Good for you. I also want to make sure that you know and restate that this is a team that's with you from the get-go. We've known you for a long time, and we want to make sure that we're going to make the right plans and the proper care for you as we go along making these decisions. Do you have any more questions for us?
No, you've given us lots of things to think about. It's been very, very helpful. I suspect we'll come up with more questions over the next days and weeks.
Great. Well, we want to thank you for taking part in this project, and we really appreciate your time, and I look forward to talking to you. Next time you're on dialysis, we'll have a conversation.
Thank you very much.
Thank you.
Thanks.
I also look forward to continuing this conversation with you both. And this information sheet that we have for you should do a good job of summarizing some of the things that we've talked
good.
about today.
Good,
Hopefully that'll be helpful.
good. Thank you.
Thank you.
You're welcome.
Thanks.